Welcome to the PARS Health TV channel. We hope you're having a good day and you are happy and healthy. In this channel, we give you tips to keep you healthy and out of trouble. In this video, we want to talk about wrist exercises to prevent carpal tunnel. This video is for educational purposes only, and if you have any specific condition or illness, you should consult with your doctor. Carpal tunnel syndrome affects millions of Americans each year, yet experts aren't entirely sure what causes it. A combination of lifestyle and genetic factors is likely to blame. However, the risk factors are so diverse that nearly everybody has one or more of them at some point in their lives. If your job or favorite hobby puts strain on your hands and wrists, you might wonder if you have carpal tunnel syndrome. Maybe you've got some symptoms, like tingling or numbness in your fingers, and you want to make sure it doesn't get worse. The good news is that there's a lot you can do to protect yourself and prevent your symptoms from getting worse. Carpal tunnel syndrome is caused by pressure on your median nerve. This nerve gives you feeling in your thumb and all your fingers except your pinky. When the median nerve goes through your wrist, it passes through a narrow path, the carpal tunnel, that's made of bone and ligament. If you get any swelling in your wrist, this tunnel gets squeezed and pinches your median nerve, which causes your symptoms. There's no one surefire way to prevent carpal tunnel syndrome. But if you reduce stress and strain on your hands and wrists as much as you can, you may keep it from getting worse. Carpal tunnel syndrome can cause numbness, stiffness, and pain in the fingers and hand. There is no known way to prevent carpal tunnel, but some exercises can lower your chances of needing surgery. If you like topics like this, make sure to subscribe to our channel and press the bell icon to see daily videos just like this one. Alright, let's get started. Here are 10 basic moves you can do any time of day. These stretches and exercises are simple and don't require any equipment. You can easily do them at your desk while waiting in line, or whenever you have a minute or two to spare. One. Spiders doing push-ups on a mirror. Remember that nursery rhyme from when you were a kid? Turns out it's a great stretch for your hands. Start with your hands together in a prayer position. Spread fingers apart as far as you can, then steeple the fingers by separating palms of hands, but keeping fingers together. This stretches the palmar fascia, carpal tunnel structures, and median nerve, the nerve that gets irritated in carpal tunnel syndrome. This one is so simple even your office mates won't notice you doing it, so you don't have any excuses for not trying it. 2. The shake. This is as straightforward as it sounds. Shake hands like you've just washed them and are trying to air dry them. Do this for a minute or two every hour to keep the flexor muscles of your hands and its median nerve from getting cramped and tight during the day. If that sounds like a lot, you could even integrate this into your hand washing routine. You are washing your hands frequently, right? If not, use your carpal tunnel treatment as another reason to lather up more often and keep the flu at bay. 3. Stretch Armstrong. This exercise is the deepest stretch of the set. Place one arm straight out in front of you, elbow straight, with your wrist extended and fingers facing the floor. Spread your fingers slightly and use your other hand to apply gentle pressure to the downward facing hand, stretching your wrist and fingers as far as you're able. When you reach your maximum point of flexibility, hold this position for about 20 seconds. Switch hands and repeat. Do these 2 to 3 times on each side, and try to do this stretch every hour. After a few weeks of doing this multiple times a day, you'll notice a significant improvement in your wrist flexibility. 4. Fist to stop sign. Make a fist. Slide your fingers up until they point toward the ceiling like you're telling someone to stop. Repeat 5 to 10 times. 5. Fist to fan. Make a fist. Fan your fingers out, stretch them as far as you can. Repeat 5 to 10 times. 6. Thumb touches. One at a time, touch the tip of each finger to the tip of your thumb, so they make an O shape. Repeat a few times. 7. Basic wrist stretches. Sit down at a table. Rest your elbow and arm on the table and let your wrist hang over the side, the palm of your hand facing up. Start with your hand in a straight, neutral position. Bend your hand toward you so your fingers point up toward the ceiling. Hold for 5 seconds. Return to a straight, neutral position. Bend your hand away from you so your fingers point down toward the floor. Hold for 5 seconds. Return to a straight, neutral position. Repeat 10 times. Do this up to 3 times a day. 8. Wrist resistance. Sit down at a table. Rest your forearm, wrist, and hand on the table, with your palm facing down. This is the hand and wrist affected by carpal tunnel syndrome. Lay your other hand across the knuckles at a 90-degree angle, so your hands make a plus sign. Lift your bottom hand up, but resist with your top one. You'll feel this in the muscles of your forearm. Repeat a few times a day. 9. Wrist curl. Sit or stand for this one. Grab a 1-pound weight or a can of beans. With your elbows at your side, lift your forearm so your arm makes an L shape. Your forearm should be parallel to the floor. Start with your wrist straight and neutral, palm with the weight facing down. Bend your wrist up. Return to a straight, neutral position. Repeat 10 times. Do this up to 3 times a day. 10. Hand squeezes for grip strength. Squeeze a pair of balled up socks or a soft rubber ball. Hold for 5 seconds. Repeat 10 times. Do this up to 3 times a day. If you have mild or moderate symptoms of carpal tunnel syndrome, you might get some benefit from a few simple exercises. But keep in mind that studies are mixed about how much they help. You'll get the best results if you do them along with other treatments, like using a brace and tweaking your activities so they put less strain on your hand and wrist. When you try hand exercises for carpal tunnel syndrome, remember this isn't like going to the gym to lose weight. Forget the whole no pain, no gain idea. If it hurts, take a break. If you push it, you can make your symptoms much worse. If you are interested in videos like this, make sure to like this video and subscribe to our channel. We hope you have a wonderful day. See you in the next video.